Welcome, everyone, to the recording of our recent discussion with Deb Daniel and Jessica Havens. Before we get into it, I'd like to tell you a little bit about our organization. The National Network of Healthcare Hygienists offers certificate level education for licensed dental hygienists who have an oral systemic health focus over dental health alone. We offer professional membership and unsponsored, unbiased, research based programs in areas of oral systemic health. If you have a passion for medical dental integration, check out our online and self-paced certificate programs available, which include the Leadership and Quality Improvement Program, our Foundational Accredited Oral Systemic Educator Program, our Oncology Certificate, our Oral Facial Recovery, and Cotton Method Certificates. Also coming later this year, our Airway and Sleep Medicine Certificate, so watch out for that. Now to our guests, Deb and Jess. These two ladies are former RDHs who successfully spread their wings into broader healthcare administrative roles to build careers that fit their needs and professional desires. I sat down recently with Jessica and Deb, and they are instructors in our online certificate program that we hosted called the Leadership and Quality Improvement Certificate Program. I did want, before we get to the transferable skills portion, I always love that because it really gets us thinking outside of that like clinical curate in hand skill that we have that is so specific.
One person is a hygienist in California. She was doing her master's. It was either in health administration or public health. I think it was in health administration, if I recall. And she had done a lot of different roles and moved up in hygiene. She was sort of doing treatment coordination and then education and some different roles. I helped her with her resume, building her non-clinical resume and really pulling out the skills that she had. And she applied for an administrative fellowship, which is very common in the US, which is what I did as well. Not so common in Canada. I did one of the few Canadian ones. And she got an interview. And she had applied before and with her other resume, and she hadn't gotten any interviews. So her adapting her resume helped her get an interview. And I didn't even help her prep for the interview. She did it all by herself, and she got the administrative fellowship. So that was above nurses, that would be above other business students. So I would say that that was a huge success and like so proud of her for that. And then the other person was in Texas, and she was working in one of those sort of dental billing type of, again, very foreign to Canada. Um, but we were talking, and I was helping her with her resume. And she said something about her team. And I was like, "What do you mean your team?" And she goes, "Oh, there's like 7 people." And I was like, "What? You're a team lead?" And she was like, I guess so." And I'm like, how many people is in this so-called team of yours? She's like, 7. I'm like, I'm sorry, you're a team lead for 7 people and you manage performance management, hiring, recruiting. Well, yeah, I guess. I'm like, where is it on your resume? And so we did her resume, and she's now been promoted within her company to, I'm pretty sure, a director type role. And just hearing people say, I didn't realize I did that,
Yeah.
is some of the biggest successes as well. Oh, sorry, regional manager. So that's it. And then people that we help prep for interviews that then get the jobs.
Mhm.
And it's been across Canada and the US. But those are probably the two stories that come out at me. And probably the biggest one is the person in Texas who was like, I manage a team. Like,
Yeah.
like she didn't even
It didn't
realize.
even really realize that that was a skill or that that was important when it's like hugely important.
And a team of 7 is not small.
Exactly. Oh my gosh. Okay, good. Jessica, do you have any one that pops to mind or bubbles up to the top?
I don't have a specific person, But one of the things I really love about the work that we do when we sit with people and we help with the resumes and we reframe the work that we do in hygiene, the aha moment when folks realize that what our job is so much more than scaling teeth. We really do have a lot of communication and knowledge translation skills. We have people management skills. We have time management skills. We retain document integrity. We follow legislation. And I think we have a long history as a profession of being modest and kind of fading into the background. And the confidence that I see everyone who goes through this program and everybody who we work with develop, even if all we're doing is going over a resume, not doing that interview prep.
So let's
Absolutely.
talk about API.
Yeah. Yeah, let's talk about
So
it.
I am a PMP project manager. I also have my ProSci change management designation and my Lean Green Belt. So I can explain all three of those certifications with API. So when we do API, our customer is the patient, right? The patient is at the center of what we do. So as a project manager, my customer is whoever I'm working with, right? It could be a patient, it could be a doctor, it could be a politician, whoever it is. So guess what I do? I assess their needs and I assess what the problem is, right? Sometimes we do a root cause analysis. What we're trying to do is determine what their issue is. Guess what? That's the A in API. Now that I know what the problem is, I start planning something, right? Whatever that project is, whatever that intervention is, whatever we're going to do to try to solve that problem. So it could be a technology, it could be a change program, it could be whatever. So I'm planning something, just like the P in API. And guess what I do next? We implement it.
You're going to implement it.
We
What have you
implement
planned?
it. Whatever we planned, we implement. And guess what we have to do to see if what we've implemented works?
I guess we'll evaluate that.
We have to evaluate it. So when I talk about a project management cycle, right, there's the initiation, there's the planning, right? There's the implementation phase to go live, and then we evaluate and we close a project, right? So it's not ongoing, but API was the foundation for me as a project manager. In change management, we do the same thing, right? But we're looking at people and change. So if you think about if you worked in paper documentation like me, by the way, and then you move to an electronic system, that is a project. Okay? It's a project because we implemented a software, but it's also change management because we've gone from writing our notes to now using an electronic system. So change management is about the people side of change. So we assess what people know and where they are currently. We plan how we're going to train them, what we're going to do to help them get ready for the change. We then implement the change, and then we evaluate how well the change went into practice. API again, just in a different way. And then in quality improvement or process improvement, which we know that every single person in this room does and has no idea that they're doing it because we never ever have talked about it. We have things called PDSA cycles. So what happens is there's some process that's broken. Think about your infection control process. Okay. All those steps that we do in infection control is technically a process. So something breaks in that process and we need to fix it. Someone's not following the protocols, a machine breaks down, whatever that is, we need to fix that process. Guess what we do? We try to figure out what the problem is.
So that would be our D in ADPIE, diagnose. Find out the
Then we
problem.
plan an intervention.
Yeah.
Then we do it in the PDSA cycle. Then we study it. And then we either accept it or we review it and assess it to see if we need to do it again. And a PDSA cycle is a constant. It never, like it can end. But so API has been the foundation, my dental hygiene API, for pretty much everything I do
Yeah,
when it comes to projects change and quality improvement or process improvement.
there we go.
And if you have x-rays on your resume, guess what? That's an assessment tool. X-rays is not shouldn't be on your resume.
Yeah,
It's not
not
a
take
skill.
x-rays.
Your
Yeah,
ability to
yeah.
use the x-rays as part of an assessment
Hmm.
is the skill.
And the interpretation and understanding and translating what you're seeing to your little
Absolutely.
project every hour.
Yeah.
Yes.
I love that, right? We have, well, some of us have more than others, but 8 projects every day we take from
Yes.
beginning to completion. Well, almost because we have them come back to do that evaluation side of it. But yeah,
Yep.
really, really
Exactly.
cool to kind of envision that.
Understanding how to describe what it is that we do is very important. And when we can get a better understanding of what we're already accomplishing in our day-to-day lives, I think it opens up a world of other educational opportunities for us as well. So I shared in the chat the project management professional certification. This is a skill or certification that can be applied dental offices and beyond. I think it's a great one for somebody who's interested in becoming an office manager, for example. Um, and you really don't need to go back to school right away to finish your bachelor's or go for your master's. I would say start by looking at the skills that you have and understanding what's needed in your context and what do you enjoy doing. You can develop communication, you can develop human resource management within an existing clinical setting as well.
What are some of the biggest misconceptions that you find when you're talking to hygienists that are looking to transfer to other roles outside of clinical, outside of on the tools sort of work?
There's a couple. Probably the first one is I have an associate's degree and I've been working in clinical for 10 years. So why can't I do the job that's going to a nurse? Or why can't I be a manager of whatever? And what we're trying to get people to understand is that we didn't get here, we didn't get into the roles that we're in now by just staying in clinical, right? We've done more education, or we've taken the opportunities like Jess had in her practice to expand, to do things like be the joint health and safety auditor for OSHA. There are some people who do research. I was helping someone with their resume last week, and she had developed education resources for her practice because they didn't have any on certain perio procedures. And she didn't realize what that was. So it's if you've done nothing but just your clinical job, which is okay. No one's saying there's anything wrong with that. But if you've just done that and nothing else, and just have your associates, when there's a job asking for an undergrad or a master's and someone who has experience, with certain things, no, you don't get that job because you need to earn those skills through your work and expanding your mind. So it doesn't mean you necessarily have to go out and get that degree. But if you want to get those type of roles, you need to look at what the job description is asking for and then ask yourself, what do I need to do to get that experience? If this is something that I want. So, the misconception that like you don't have to do anything else and somehow what you have done is enough. It sometimes is, but sometimes if there's something you really want, you have to look at what they're asking for and take the initiative to do that. And the other misconception is on the flip side, is that I can't do it. I don't have this. I don't have that. And that's where we are saying people have all these transferable skills, or they're building education programs, or they're managing a team of 7 people and don't even know it, that they think they can't do it, but they actually do have a lot of those skills. So I think it's sort of both sides of the coin. And that's why we really developed the leadership and QI program with you guys, because we knew from our own experience that that was important education that we never got when we were hygienists. So the whole point of the program is to expose hygienists to some of these concepts and these transferable skills that they already have in human resource management and quality improvement, in team dynamics and conflict management that they're already actually doing, but don't have any formal education on it. And that's what the whole program that we worked with you guys on.
What can you comment or what can you tell us about that in terms of like choosing the next thing, especially if it's more of like a degree or, kind of going to that next level educationally?
Sure. So, I think that one of the things I really like to reassure people is that in my job, I do a lot of hiring. And while there are certainly things that I look for because it's a medical legal position, I need people to have an ability to understand medical terminology. I need them to be able to read and interpret legislation. I've got folks with all kinds of backgrounds. We've got a couple English majors. We've got folks with tech backgrounds. We've got plenty of people who finished high school but never finished a degree beyond that. And as a hiring manager, I really don't worry about what the precise degree is that somebody has. I worry about whether or not can they demonstrate to me that they have the skill set that I am looking for. So I think when you're looking at career advancement and you're looking at next steps, really thinking about the job that you're applying for and how can you demonstrate that you have the skill set that meets that criteria, even if you have a bachelor's in dental hygiene that you kind of regret getting, but it seemed like the most logical option at the time. And as far as if I were considering or advising people on different degree programs now, I would say never underestimate the power of business, of communication, health information technology. These are all areas within healthcare where the clinical background that you have actually feeds into what you're going to learn into that program.
Awesome.
Just to highlight, I have an undergraduate degree in psychology through science. So it is a little bit more broad than dental hygiene, but it's not like I don't have some spectacular, engineering undergraduate degree.
Yeah.
So it's what you make of it. And the beauty of an undergraduate degree is that you can take all different types of electives that can open up your mind, like taking health economics. I took an animal behavior class, by the way, and it was awesome. Right? We
I
saw
never knew
fruit,
that.
yeah, fruit flies fighting and why they fight, and so you can take all of these different cool classes as well. Environmental psychology changed how I think about the world. So like it's an undergraduate degree is what you make of it. And yes, it one may make you more focused, but things are changing, right, from when we started. And there's a degree in Ontario. It's an undergrad, it's a Bachelor of Science in Allied Health something, right? Like, so there's new programs now
Mhm.
that are actually meant for allied health. So do your homework. That's actually one of the other services that we offer, is like education planning and education sort of matrices and decision making. Um, so to look at different programs and how to find them and how to evaluate them. because each one of them is unique and it depends on how you want to use it.
Good. For those who are joining us, if there's any questions that are popping into your heads, you can go ahead and throw them into the chat, and we will ask the ladies some more questions if there's anything that you feel like they haven't touched on yet. I wanted to kind of shift now to professional networking, and I know you guys talk a lot about that, and that can be something that's really within your wheelhouse or really super foreign. So tell us, for the ones that that's a very foreign concept to them, what kind of recommendations and tips do you make there for professional networking?
Start local. Think about your patients. If you ever have opportunities to communicate with the other care providers that support your patient, let's say you've got somebody who's going through chemotherapy and you're talking to them about dry mouth and radiation and how that might affect their experience. If you can develop a relationship with other practitioners, they can understand what you do. That's going to help build your confidence because you share an area of knowledge, which is this patient. It helps you realize that you can be respected by others. You can also participate locally if you attend any in-person CEs. Stay and talk to the instructor afterwards. Ask a couple of questions. See if they have any ideas about other programs if you're really interested in that. Your dental hygiene professional groups. I was very active in the ADHA group in Kitsap County in Washington, and that was really huge for me for developing my own networking and leadership skills. And I would say I was pretty shy at the time. So start local. You can connect with other allied health professionals or other health professionals, talk to the instructors of the CE classes you attend, and then your local dental hygiene association as well.
Great. The certificate
Those are really,
programs,
oh,
yeah.
sorry.
Yeah, no, I was just going to say the certificate programs with the NNHH are also there to help build your confidence so that you can have these conversations with your collaborative care partners and people that, you might just sort of think, I'm just the dental hygienist, but no, you're the dental hygienist. You're looking after the preventive side of oral health that's going to save lives and improve outcomes. And we have to see ourselves that way. So I always, a little plug for the OSE. That foundational program is really great for that confidence side and the speaking, the medical ease
Mhm.
language, right? So go ahead, Deb.
If you do not have a LinkedIn account, it is the best way to stalk people without it being stalking. So that's how I got my first job at the hospital for sick children, out of my master's because information gathering, yes. Because someone saw that I was doing a quality and patient safety fellowship, which by the way, I named myself because they didn't have a name for me and I thought it sounded nice. And we started talking and I had come back to Toronto because that's where my husband and my family were, when I was in Vancouver, and I met with her. I took her out for coffee, and a job had come up, and she put me forward for it, but I didn't get it. But I had already interviewed. So then another job came up at a different time, and I ended up getting that job. So that all happened through LinkedIn. LinkedIn is a great way. If let's say you want to work for, I'm making this up, Philadelphia Public Health. Okay, like, because we were talking about Philadelphia at dinner. And you go onto their site, you can see people who work there and you can talk to them and you can do, we call them information interviews. You never, ever, ever ask anybody for a job ever. You ask them for an information interview. This is who you are. You're, looking at different options in your career. I'm really interested in how you got to where you are. I would love to talk to you about your story and any advice that you have for me. I've not asked once for a job. And when there are networking events for different groups, whether it's dental hygiene or some other type of local business group, take it. I went to a speed mentorship event, which was like speed dating, by the way, but for mentorship, because I needed CE credits. And the person I was talking to said, I know someone like you. And my answer was bullshit. There was other swear words, but the answer was bullshit because there are tons of hygienists with masters, but I had never met anyone who also ventured outside of dental like I had. And she goes, no, 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 I know someone like you. And that was Jessica. So that is how
Really
I met
important.
Jess, was through a mentorship event that I only went to because I needed some CE credits. So you never know. Um, you never think you're going to get a job. You never think you're going to meet your soulmate that's on the other side of the country, your work and dental hygiene and best friend soulmate, like, and you just do. So and you can, right? You can get absolutely rejected. People won't talk to you. You take the good with the bad. You're going to try to information gather slash stalk people on LinkedIn that won't talk to you, and then others who are willing to talk to you. So you have to take the good with the bad.
Yeah, it's just like anything, and a door closes, another opens type thing, right? Help people with resumes and interview prep and that type of thing. So, how does that look usually, and how can people sort of reach out to you about those types of activities?
So we have a website, which is often where people find us. We also have a Facebook group. And the resume sessions, Deb's been supporting the majority of them recently. What it typically looks like is you present the resume that you have. And we often ask you to share the kind of job you might be looking for, some job listing. It doesn't have to be a job you're looking at now. It can be something you've applied for in the past. And then we walk you through some areas of your resume that could be tweaked to support a stronger application in the future, showing you how can you pull language from the job description and use that to kind of match experience that you already have that maybe you didn't necessarily think about because we're used to talking things in a different way. It's almost a kind of code switching going back and forth between the way a job that's in healthcare, but perhaps it's administrative or it's regulatory is going to be very different from what we talk about clinically. You may already have those skills. So we're going to help you think about how you can make changes in your resume. And we try to do this in a way where we want to make ourselves obsolete. We want to give you the skills to carry forward, to apply to your resume again and again and again, so that you know how to do it. We're not just making your resume for you once, we're skill building.
Hmm.
That's
Awesome.
probably the most important part of what we do. There's lots of people out there on Instagram and, oh, we'll make you a non-clinical resume, but you haven't learned anything. And what you give them is what they give you back, right? And if I hadn't sat down with that woman from Texas and she told me she had this team of people, like that would have never come out. So it's not that I'm not discounting anybody else or putting down what anybody else does. That's not what I mean. But our philosophy is like what Jess said. We want to be obsolete, right? We want to help you. We do it with you so that you can build the skills and the confidence so that as you move through your career, you know how to update it. And we also show you how to use AI for your resumes in an appropriate way. Not make me a resume for this job, but how you can use it to help improve your sentences. Or if you're not sure how to say something. So you learn how to use the tool because I can tell you that when Jess and I look at resumes, because we're both hiring managers in our jobs, you can tell when it's come from ChatGPT. Like you can tell. So
And
how
not
do you
touched.
use AI? Like how do you use AI in an appropriate way? And again, so that you can do it. And that's the other thing with the course that we built with you guys is that when people take it, it's a couple of hours. It talks about really the things that we do, but also then builds on it. So if you take it, you'd be like, oh, I am doing that. And then you find a new way how to say it, right? So between sort of the course and what we can offer with resumes, um, those are all really important pieces to build again, your self-confidence and helping us become obsolete in your life in the sense that that you're able to do it. And then the next thing is if you get an interview, like I could probably take a poll of this room and be like, how many people have walked into an office, were smiley and friendly and got the job, right? That will not get you a job in public health.
No.
That will not get you a job at a hospital. That will not get you a job. Non-clinical interviews are very different. And if you want to get a non-clinical job, you can watch lots of videos. There's a bazillion YouTube videos that you can use, but practicing with someone, and practicing with someone who is a hiring manager and the type of things that we look for, is really different as well. So we're again trying to teach you skills so that you can take them away, as opposed to just doing it for you.
So all those people that have put out hundreds of resumes and have not gotten any bites, book a resume revamp with the ladies. And those who have gone to 100 interviews and haven't gotten the job, book an interview prep, right? So you guys touched on the leadership and quality improvement program. There's a free trial on right now for that program. Can you tell us about that?
Absolutely. So this is a 7-day free trial. And what that means is you can enroll in the program, you can start to go through it. Um, because it is 7.5 hours, I really love that this is a 7-day free trial. You can take the time that you need to go through the course little bit by little bit and really get familiar with the information. We don't recommend rushing it. Take your time, reflect on each module before going to the next one. And you can sign up for this 7-day free trial on the healthcarehygienist.org website. If you go to the Leadership and Quality Improvement Program page, the link to sign up for the free trial is right there on that page. So NNHH has made it really easy to get a sample of this course and see if it feels right for you.
So the first module in that is the Intro to Leadership. What can people expect from that, Alan?
Yes. Intro to leadership feels like it's a really fluffy topic, but it's so important because it's something that we do all the time, and it gives you an understanding of yourself and the way that you work that's going to help you think about other aspects of this course: human resources, project management, knowledge translation. So within the intro to leadership, we're talking about what the leadership theories and styles are, and how you can assess your strengths and figure out what you might need to work on. And then we also want to teach you some different ethical principles for leadership within the workplace. These are, of course, going to be applicable in your current role, but also in any others that you may take on in the future.
Great. Module 2 is the human resources, as you mentioned. What kind of things do you learn in that
I
section?
think the best and most practical part of that section is conflict management. If you're in a clinical position currently, that's something that you can practice immediately after you close your computer, and you can work on it with patients, with colleagues. It's something that I do all the time in my HR role. Of course, this introduces other HR concepts that you might not be familiar with, such as a professional development cycle and how to have performance conversations.
Oh, good. Number 3, project management. That seems like it should be way more than an hour, but I know you just kind of go through the nuts and bolts of it. What's that one like?
My favorite. Um, it's about the principles of project management, but more it's about what we do in our clinical lives that are projects and how we apply that, how you can apply it to your practice, uh, and how you can build your skills um, in projects and thinking about the methodology, the APIE, and really how we're already doing it, but we don't frame it that way. So it's sort of some of the project management skills and the introduction to projects, but also what we're already doing that you probably didn't even know you were doing.
And exactly pretty much what you said about the project management is very similar to what module 4, the knowledge translation side of it, right? Something that we're doing
Absolutely.
all the time.
Exactly.
Yeah.
And then really thinking about how we incorporate evidence-based practice into our clinical settings. And in knowledge translation, we introduce a little bit how you think about quantifying um, what you're doing so that you can understand and monitor for improvement using metrics.
Oh, metrics. Yes. I love metrics.
We do.
And the other thing that we don't
Inflammation.
realize is COVID is a wonderful, horrible, wonderful example of how policy and evidence change so rapidly. And we had to translate that into our practice, sometimes like on a weekly basis. Things were changing so quickly. So when someone says, "Oh, I've never done that. I don't know how to make evidence into practice," or "I don't know what does knowledge translation mean," or "I've never done policy translation." Actually, you have. COVID is a horrible, wonderful example of when you did that pretty much week over week.
Yeah. But we didn't realize we were doing it. We didn't call it that. We
Exactly.
just called it chaos.
How you talk about the chaos on your resume.
Yeah, yeah, exactly. No, it's translation. Okay, module 5, program development.
Program development was really key for me in progressing my career. And so, one of the examples we talk about was the implementation of periodontal program while I was a team lead in my last office. So, we walk you through how to figure out what a program might look like, thinking about the appropriateness of the population you're going to be serving, and how to support that program over time and make changes so that it can adapt and grow.
Awesome. Very good. Module 6, diversity, equity, inclusion.
Yes, so this has been a hot topic over the last couple of years. There's some changes happening in this space. But as hygienists, I still feel it's very important for us because when we think about the populations that we serve, they're not usually homogenous. We have a broad range of patients from all kinds of backgrounds. And diversity isn't just racial, right? It's socioeconomic. It's, you've got your military patients, your union patients, and the other hygienists you're working with, they come from different backgrounds too. So it's hugely relevant if you're doing anything in human resources, but it can also be really helpful in a regular clinical setting. Understanding people and where they're coming from can be super helpful for conflict resolution as well, can inform program design, and it can help you consider whether, if you're developing a project, there are other aspects of the population you're working with that you need to build into that.
And
Great.
regardless of, you know, political beliefs around that, if you want to work in public health or any type of government or public sector type role, Canada or the US, there's most likely going to be that type of question in your
Hmm.
interview, because that is the focus of public health and public
Hmm.
sector. As what Jess said, you work with different communities, different socioeconomic status, different backgrounds, different religions, different cultures. And in your team, within your practice. The assistant could be from this country and you could be from there. And one of the other hygienists may be part of the LGBT community, and you have a patient who, is a newcomer. So again, regardless of your political belief on that subject, it's actually part of our practice currently. And again, if you are looking to move into a public health or a teaching or any of those type of roles, you can expect there's going to be some sort of DEI question on your interview, in your
Mhm.
interview.
Yeah, for sure. And then last, number 7, one we all love, the mentorship and networking module. So great. I love this one. Tell us about
Um, So with this one, we talk about building and maintaining professional networks. So we talk about the difference between being a mentor and being a mentee, how you can often be both simultaneously, how engaging with other professionals and talking to other hygienists can be a really good way to support your own career development. And then we talk about different ways that you can network, including LinkedIn, including groups like Deb, what's the leadership group that you're in where you met and talked to Nicole before she introduced
The
us?
Canadian College of Health Leaders.
Yes. So we talk about that and a few other groups as well. And yeah, I mean, I think that we as hygienists do so much mentoring already with our patients that it's a skill we don't necessarily, it's again one of the many skills we don't realize that we have, but it's in us already. And we really just need to get brave about making those connections with other professionals.
Yeah, absolutely. And like I said, you just sometimes you never know which conversation might help you down the road or help you make a decision about your
Change your
career.
life.
Yeah, could change your life. Exactly. All right. Were there any other questions that the audience had thought of? I know there was a few comments here. I think are mostly Jessica making some great comments here. Shannon has said a couple of things. No questions though. We'll probably
There's no stupid questions. And we encourage, if you don't feel like coming on camera, that's okay, to come off mute and ask your question or to type it in the chat, because I promise you, we have been where you you might be in your career. Um,
Yeah, Liz has got a question here. How does grant writing work into getting oral health protocols into hospitals and medical clinics? Grant writing.
Any kind of formal communication experience, grant writing is one, is really important to have if when we're talking about um, oral health protocols into hospitals and medical clinics, if you can use your communication skills to frame that there is a problem that needs to be solved, if you understand your audience and you're able to identify their interests and you can demonstrate how the problem you're trying to solve fits within their interests, that's going to give you a much better chance at getting oral health protocols into the hospitals and medical clinics that you're looking at doing. Renee, I love your question about volunteering. Volunteering is experience. It's absolutely relevant. Anything you do in volunteering can go on your resume, and it's a great opportunity to stretch your skill set um, at the same time.
And the networking as you volunteer.
Absolutely.
When you're
Yes.
volunteering in front of those people, right? So I would say it's very important as well.
so volunteering, I also want you to think a little bit outside the box. Um, Committees. So joining a committee, let's say for the ADHA or the CDHA, I sit on a committee, the Healthy Workplace Committee for the CDHA. Um, Pretty much any YMCA or any community organization, no matter where you live, has a board, has a volunteer board of directors. So it is a great way to get governance or strategy or leadership experience. Um, you're volunteering your time, but you're actually getting a lot, and it looks really good on your resume to say that you were a board member of different groups.
And Rahab also
Liz,
asked about the interview one-on-one help over Zoom or in person, and then Deb had answered that depending on where you are, because these ladies are at either end of the country, pretty much. Probably a lot over Zoom, right? Where you're meeting with people and
yes.
they're next door.
Yeah.
Okay.
Although if
Um,
you're in Victoria, I will meet with you. Um, Liz, I do want to follow up to your question. I think I wouldn't start by being so focused on grant writing. I think take it back to understanding the particular organizations that you're looking at working with. Again, what are their goals and interests, and how can you align with that? This is actually a really great opportunity for networking. So, if you look at the organization and you can identify who the leaders are, maybe look them up on LinkedIn, see if you can reach out to them and say, hey, I really always start with flattery. I really admire what your organization is doing with regard to XYZ. I'd really love an opportunity to talk to you. I'm interested in understanding how oral health could fit into your programs. Can we connect? That might be the best way to start if you're not already within that organization. Otherwise, grant writing is something that usually happens after a program has been established, in my experience.
Good
grants are
insider
also
tip there.
grants are also often very specific to certain projects, certain groups of people. So like if you are looking to work with, let's say, an indigenous population or something like that, there's grants very specific to those. So it's good to look in some of the like the grant databases as well, depending on what you're looking to get funding for. But
Mhm.
partner, because I bet you there's someone else like a long-term care home that wants to improve the oral health of their residents. And they're more likely to get the grant because they can apply for long-term care grants. I'm making this up,
Yes.
by the way. But whatever the grant is called for long-term care, or there's caregivers. There's caregiver associations that have grants. So there's just lots of different things, but probably partnering is
That's
also a
stretching
really
that
good one.
reach as well, right? Because they have, a lot of them are like accredited and they, you know, are able to get those dollars.
Yeah, and I would plug long-term care as a really great place to start looking at how you build oral health programs outside of a dental clinic, because the folks who are there often can't leave. And so the services really have to be brought to them. So if you're looking at a way to start a program rather than focusing on hospitals, although if you're looking at hospitals, emergency department is where I would connect because dental emergencies often arrive and your average doctor doesn't really know what to do with teeth. Long-term care, tons of regular oral health needs, great place for screenings, great place for oral health education, teaching some of the nurses what to look for if there's a lesion in the mouth and when to refer. Um, Fabulous opportunity for an oral health program in long-term care.
Denture care, the PSWs that often will do the oral hygiene. Lots of different groups go through there. So very interprofessional.
Hmm.
I can agree with that because that's exactly what I do every day. 75% of my clients are in long-term care and care settings, so
Hmm.
it's an adventure.
Does
Hopefully
anybody
a
want to
rewarding
come
one.
off
Yeah,
mute
oh, it
and ask
is.
a
It is for
question?
sure. Yeah.
Does anybody want to come off mute and be brave and ask a question?
Anybody? Oh, so quiet. Oh,
We
I feel
love feral
children.
children.
Oh, yeah.
I think actually within one of our recordings, Deb, one of your sons makes a very brief appearance.
Yeah,
So
probably.
So yes, no worries about feral children. If anybody feels that's an inhibiting factor to coming off mute, we love them.
And we welcome all pets, by the way. We don't discriminate against any pets. Um,
Perfect.
that make it.
We're at 12 minutes past the hour, so if no one's really got any burning questions they want to pop off of their mute and ask, then you can always get in touch with one of the ladies or both of them if you like. Where can they reach you?
BeyondRDH@gmail.com is our address.
Perfect.
And beyondclinicalpractice .com is our website. And Beyond Dental Hygiene is our Facebook and LinkedIn groups.
Great.
And I also have, we tried to build, or I tried to build an Instagram page with Beyond Clinical Practice. I am not a generation that had social media, so I have done my best. But we also have an Instagram page.
It's great.
Check out the program. Really wanted to say thank you, Colette. We're so proud of the work NNHH is doing to
Absolutely.
grow hygiene as a profession and really make the work that hygienists do visible. And we were delighted to be able to partner with you for this program. So really happy to share more about it and also happy to answer any questions anybody has.
Great. Thank you, ladies, so much. I think this has been really enlightening. If anyone has any questions, they can always email me, Colette at healthcarehygienist.org, or reach out to one of the ladies and they can tell you a little bit more about the certificate program that we have. All online, easily accessible, do at your own pace. It's not daunting. Work it into your life in any way that you choose. So, all right, let's call it here. Thank you so much again. Everyone, have an amazing rest of your week.
Good night.
Thank you for having us.
Right. You bet.